Polio is a disease that most people have forgotten, especially here in the West, here in Canada. But polio is a devastating, painful, deadly disease. 15% of the people who get paralyzed by this disease, of the children, are going to die of that disease, and those who don't die are going to be paralyzed and live with lifelong disability as a result of polio. Polio is a disease which leaves children paralyzed for life. Often these are the most vulnerable children in the world, living in some of the most disadvantaged circumstances in the world, which means not only will they pay a price for this for the rest of their lives, but often their families are pulled into poverty as a result of the consequences of this disease. Polio eradication is about getting rid of an awful disease, but it's really about getting to every single corner of the world, every child, wherever they might be, irrespective of cultural barriers, irrespective of geography, of conflict, and really bringing a degree of equity to the world. And Canada has played an incredibly important role in this. Canada's leadership on the political stage brought polio to the G8 and brought the weight of the G8 behind this. Canadian technical expertise has helped lead the initiative in many countries of the world in our laboratory networks, in our search to find the virus. Canadian expertise in biocontainment has helped us deal with other parts of the risk. And Canadian generosity has been extremely important to financing this effort to reach every single child in every corner of the world. Also, there have been Canadian NGOs, Canadian civil society groups. One of the great heroes of the polio program have been the Canadian Rotarians, who have been out there championing this effort, not just to eradicate a disease, but to reach children everywhere. Right now, we're at a watershed moment in the polio eradication initiative. If you look at a map for 2012 of polio, you will find only 4 countries, and just parts of 4 countries, where this disease still exists. Northern Nigeria, part of Chad right on its border, in Pakistan, and right on the border with Afghanistan. That's it. And right now, we have an opportunity we've never had to get the job finished forever. We have the lowest number of polio-infected countries in the world. We have the lowest number of polio cases in the world. In the last 12 months, we've passed some huge milestones in this program that demonstrate polio can be eradicated anywhere. Just 2 years ago, the world looked at India and said, India's got 50% of the world's polio. India's got huge population density, really weak health system. There's no way we can eradicate polio in the world. India's the reason we can't. Well, just a month ago or 2 months ago, I handed a letter to the Prime Minister of India saying, congratulations, your country is off the list of polio-infected countries in the world. India has proven that we can deliver a polio-free world to future generations, that we can reach children everywhere if we have the political will and the societal will to ensure we have the resources needed to get to every child. The polio eradication program is often referred to as one of the world's best kept secrets in terms of good news stories, because this is a program that reaches over 400 million children every single year with the oral polio vaccine. It's a program which mobilizes tens of millions of people who normally don't work in healthcare to get involved with getting basic services to their children. It involves millions of parents, millions of educators, millions of volunteers who are becoming part of the system to get basic services to children. And as we get to those 400 million children with oral polio vaccines, we're learning how to get to them with vitamin A, how to get to them with a measles vaccine, how to get to them with a bed net, how to get them under that bed net so that they don't get malaria. But the infrastructure we've put in place, the lessons that we've learned are applicable to so much of what we're trying to do in maternal and child health, in health in general. It is expensive to try and eradicate a disease. We're going to spend about $1 billion a year over the next 2 years to try and get the job of eradication finished. We're going to spend about $10 billion overall. That's a lot of money, but the savings are huge. Harvard University did a study to look at how much would be saved by finishing the job of eradication. And they found that if we can get the job finished in the next few years, within the next 25 years, the poorest countries in the world will save between $40 and $50 billion. That's the most conservative estimate of how much they would save. if we add in some of the indirect benefits of polio eradication, like getting vitamin A out there in the polio campaigns, those direct benefits leap to $90 billion over the next 25 years. We're this close to a polio-free world, finally. With India going polio-free this past year, we now have 1 billion more people who are no longer at risk of getting paralyzed by polio, or at least the polio virus from their country. Polio now is cornered in the border area of Pakistan and Afghanistan, in northern part of Nigeria, and some bordering areas. Now, these are tough areas to work in, but the children there are absolutely as important as the children here in Canada and as my own child. Our goal has got to be find solutions to get to these kids with this vaccine, get this virus wiped out forever, and open the door to getting so much more to these populations.